Mental Health Act in Canada. The Mental Health Act protects people who are mentally sick, but also protects the public. So if I have someone who I think needs help, and I try to talk to them, and I notice they're not seeing an issue, I would recommend go see a doctor, their doctor. Make an appointment with their doctor and say, okay, I think, let's say Muhammad, my husband, he's borderline, he's histrionic, he's going through mental health crisis. The doctor then will call him in and we'll do an interview. This is a regular doctor. Then the doctor can do a regular interview to see if this person may need some psychiatrist, like some diagnostic or not. Then they have to advise them to say, I think you need to be diagnosed. I think, maybe you may be too much on yourself, but in a nice way, obviously, but they have to tell them that I think you need to get help. And the doctor can tell them, listen, go see help. I can recommend a referral to a psychiatrist. But if the person doesn't go and it gets worse, then the doctor can fill a form called Form 1. Form 1, only a doctor can fill it out, where it forces the person to go to the hospital. It forces the patient to go and get psychiatrist assessment. If the person doesn't go, he can call the police and the police will take them to the hospital to get them psychiatrist assessment. But again, that only gets them to be diagnosed. It doesn't force them to be treated. The psychiatrist, if they feel that this person may be suicidal, maybe depressed, maybe they're going through an issue, the psychiatrist can ask the judge to force him to be treated.
And when we talk about the treatment here, is it like
therapy,
through therapy, hypnosis, or also like through drugs and medicine?
It could be, sometimes they do like 6 months and they say, okay, you have to come every week to my office. We do therapy one-on-one, or it could be antipsychotic, whatever drugs they need. It doesn't have to be drugs. And I'm not talking like the Middle East, Muhammad, where they put you in white jackets and tie you, and I'm talking about like hospital where you go to the psychiatrist ward, where you sit there for 72 hours. You're not locked in a room, none of that stuff. And you just get an assessment by psychiatrists, and they watch you to see, and they try to talk to you, but they have to tell you about your right, because as a Canadian, you have the right to refuse treatment. But only a psychiatrist, not the general doctor, can decide whether he thinks or she thinks you need treatment. But you as a patient can ask for a lawyer to say, I don't think I need treatment. I think the psychiatrist is wrong. And then the lawyer will get another psychiatrist to assess you. So there is a law there to protect the patients, but it also protects the public. Because you don't want someone who's histrionic or borderline who's gonna go around killing people.
Of course, yeah.
In the street. You don't want someone, and watch out if somebody says, I wanna kill myself. When you hear that word, if they just said it, you have by law to call your doctor and let them know someone is thinking about suicide. I'm trained on suicide prevention. As soon as you hear a friend, a family member saying, I want to kill myself, talk to them a little bit. But if you not know what to do, don't call the police, call the doctor and say, I think he considered it once or twice. So I think he needs to go see a psychiatrist. Can you convince him? You ask your doctor, can you convince him to go on his own? It's called voluntarily. If he doesn't go, your doctor can get Form 1. It's called involuntary, where he's forced to go by himself. If he doesn't go, the police will take him. The police will come and escort him.
Yeah, because now you're causing like danger to the society. You're
to yourself, not just society. Yeah. Because when somebody says, I lost 2 patients, okay? So I'm telling you, it's not pretty when somebody...
So if you're suicidal, or you're being too over-aggressive to others, or to yourself, of course, by being suicidal, then by law at this time you can be obliged, you can be forced, they can force you to seek help.
Yeah,
so
then
it will be optional.
But also you have the right to be informed. They cannot just call the police on you. The doctor has to enforce Form 1 only if you refuse after he's giving you your options. Mm-hmm. Right? It's sad. It's really sad.
Of course, yeah, but it's I think it's very important for the safety of individuals, like your own safety and the safety of people around them.
That's why they end up in jail.
Absolutely, absolutely, absolutely.